Adolescence is a time for exploration and independence. It is common for teenagers to experiment with drugs and alcohol. However, it is important to be aware when use progresses beyond just the experimental stage. Typically, substance use can proceed in the following sequence. It can start with experimentation, then go to recreational use, regular use, then abuse, and then finally dependency. Any use, however, can impact an adolescent's brain, especially as the brain is not fully developed until approximately 25 years old. It is also important to be aware of particular risk factors for an adolescent potentially developing a problem with substance use. Certain teens may be at a higher risk of substance abuse when there is an underlying mental health concern or diagnosis, antisocial behavior, especially aggression, poor self-esteem, low problem-solving abilities, school failure, a learning disability, peers or family members who also use substances, isolation from others, a history of physical or sexual abuse, and a family history of addiction. Adolescents need facts and education around substances and use versus relying on myths or misconceptions for information. People who are important and influential in a youth's life, including parents, relatives, mentors, teachers, and/or therapists, can find ways to give accurate information to teens around drugs and alcohol. It is also helpful for teens to have someone to talk to, learn coping and refusal strategies, and ways to increase their self-esteem. Adolescents who may be struggling with a drug or alcohol problem need more support in the form of treatment, which typically includes abstinence from the substance, education, individual, group, and family therapy. It is crucial that the family is involved in the treatment, as change and success is more likely to occur than when just the individual is engaged. A good resource for teens, parents, and teachers to access for additional information is the National Institute on Drug Abuse, or NIDA.